podcast with Joseph, our CEO and creator of V-Line Power Lift. We're at the Walnut location today, and I'm so excited to see you guys again for the YouTube live a monthly event. Okay, so today we're going to talk about everything you need to know for injection of Botox and on how to improve wrinkles. So I have this is Sarah, this beautiful girl with me, and we're talking about like what's the side effects? What are the side effects of Botox injection? Where to inject, where not to inject? Okay, and please stay tuned because after the live demo, we're going to choose 10 people, and we're going to give out free 10 units of Xeomin for the wrinkle injections.
Yeah, so a total of 100 units of Xeomin will be given out to participants. We appreciate your time and attention and to learn more about this.
And after that, we're going to have raffle. We're going to announce the raffle winners of the V-Line Power Lift filler that we appreciate people who participate in Yelp review. Okay.
Hi, thanks for okay. So Vicky, what's the first part we're going to talk about? There are 3 parts.
Okay, so the first part we're going to talk about is the side effects of the toxins.
Because we're talking about it, so be sure that you're going to be fine. Come to, we're experiencing this area. So if you guys want to pen in, so the number 1 possible side effect is, if you look at this arrow, means that you could possibly feel very heavy right here after injection. Okay, again, this will not happen to you because we're talking about it. Chance is extremely rare. Number 2, you could potentially flatten the brow instead of lift it. Okay, so that's another possible side effect, another arrow. Number 3, there's a chance that instead of opening up the furrows, you could actually feel more squinched up. So I'm gonna draw an arrow there. Worsening furrow lines. Number 4, the famous droopy eyelids. After injection, some people, if you look at here, we have our beautiful Sarah here today. Look here. So you all feel like your eyelids, not the brow, but the eyelids actually go down and cover half of your eyes. All right, please don't be scared because we're pretty good with anatomy and we'd love to see you and give you safe treatment. Number 5, potentially when you inject, smile for me. Instead of smiling, you might have a droopy cheek, like, oh, did I just get a stroke? It sounds really serious, but no, very temporary. Okay, so I'm gonna put an arrow down this way, where you can't really raise your cheek when you smile. And what number are we at? Number 6. When we inject the bunny line, show me the bunny lines there, right there, perfect. And squint your nose up. Yep, you see those bunny lines? If we inject too low, like in this region, there is a chance that your lip here may drop. Okay, that's the weird one. Okay, we're up to number 6. When we do the lip flip here, I'm gonna put a drop here. If we inject too deep, again, this lip may flip in, invert, or drop. Number 7, when we try to lift the mouth corner here, if there's a chance that this could also give you a lip twist like this. Yep, twist your lip like that, sorry. You have beautiful lips, by the way. Okay, so that's the 7 possible side effects. And number 7, when we treat the chin, could you tighten your lip for me? Okay, you see, she's very beautiful, just a little wrinkles here. Okay, orange peel chin. When we try to inject here, there's a chance that, again, your lips may twist like this. Now, you guys all know about the Power Slim, where we inject the masseter, okay? Right down for me, okay? When we inject in this region to slim down the jawline and also to tighten it, if we inject here, a couple of things may happen. Number 1, we may not be able to, let's go ahead and smile. You might feel that there's very tight when you smile. Number 2, you actually find more, right down for me. Instead of the bulge going in, you actually you might have a chipmunk look where the bulge kind of comes out. That's the another thing. Number three, treating in this region, people may experience a droopy mouth corner where the marinade gets a little bit worse. So injecting here, those are the three potential ones. By the way, the fourth one is injecting in this region. If we inject too superficially here, or too high, you might create a excessive hollow, or we call it zygomatic hollow, where you actually erase your natural V by creating a deep hole, causing this cheek to pop up too much, so you look kind of skeletal. Okay, now let's just review real quick. For the upper face, possible side effect, you might feel heavy, you might flatten your brow, you might look a little bit more worried than before. There's a chance of dropping the cheek, dropping the lip when treating here, dropping the mouth corner when we treat here, or twist the lip like this, or when we inject here. Wow, you said, wait a minute. So far, this hasn't happened to me when I come to see you, but the good thing is this, guys. All these are very temporary, okay? They may be a little bit bothersome, but they're all resolved. And look for experienced injector who understand anatomy. We love to take care of you. All right, now let's talk about the neck. There are a couple of reasons people do the neck treatment. It could be for show me your lower teeth, Sarah. It could be treating these bands, okay, one. It could be getting rid of the necklace line. It could be just for rejuvenation, where we put Microbotax. We call it Botox. We use a Xeomin. All right, so if some people, when they take too much, they might have, number one, difficult swallowing, okay? I haven't seen it yet, that's possible. Number two, a lot of bruising sometimes there. Number three, just a little bit difficulty in pulling up the weight after you inject. So again, these are temporary, and we love to take care of you safely. All right, so that was any question. And while we film this on our social media, people could also let me know what question you have. So Vicky, that was our first. That was as I clean, we're gonna get ready to talk about then exactly what area, and you want to memorize this. Should we not inject to avoid these side effects? So this is what I'm going to go through real quick for you guys. Okay. Let's wave to the audience, and if you have any question, let us know. And
okay, so yeah, next we're going to talk about where not to inject, and after that we're going to demonstrate what's the proper way to inject. All right.
Okay, so the first one, to avoid giving too much. Number one, to avoid feeling heavy, try to give very little to get rid of wrinkle in the front in this area. Number two, to avoid furrowing up, you try to put it in the right depth in this region when you're treating furrows. This should be deep, medium depth, superficial. So, okay, we're talking about what area not to inject, so I will tell you what area not to inject. Here, it's about dosage. Don't give too much, okay? Here, you have to go superficial. If you do superficial, she will go like this. If you go too high, you hit the frontalis, she will furrow up. Okay, number three, how to, I'm gonna insert this one. Number three, how to avoid the Jack Nicholson, like the overly surprised look, okay? You avoid that by making sure this muscle here is not overly powerful. Look up for me, okay? So you do not want to inject here. You do not, to avoid Jack Nicholson, you could do a tiny drop here. Or if sometimes you avoid not treating it, this might be too strong and polished, so you have to assess whether it's just going to get a Jack Nicholson. Okay, number four, bunny line. You don't want to inject here, not too low. Another one here. I'm just gonna keep going. That try to inject above. See, you draw a circle here and try not to inject here, outside the orbital rim. One thing I didn't mention is that if we inject also too close here, you could get blurry vision because the toxin or the Xeomin falls into the eye and you get blurry. Probably for a month, So we try not to do that. Okay, and to avoid the stroke look, again, try to not inject here. Try to inject right here. Let's see, droopy mouth corner. Try to inject, not inject too deep here. And for the bulging, how can you inject here to shrink it and not bulge out? You want to avoid inject too superficial right here. Okay, how do you avoid hollowness? You want to avoid inject too superficial. Okay, and how do you avoid droopy mouth corner or worse than marionette line when you inject here? You want to control the dosage, so I'll put D for dosage. Okay, not to inject too much. And how to inject here? What to avoid? Try to inject, try to not inject outside of this region. So let's say if you inject here or anywhere here or here, you risk twisting the lip. And about the neck, it's important. Smile, lift your, yeah, okay. You see this platysmal right here, okay? Try not to inject, when you're injecting this, try not to inject this region. That's the sternocleidomastoid or shell neck will flop. And try not to, when you pull this out, try not to inject too deep because you might get the swallowing muscles. And if it spreads, you might have hoarseness when you speak. Let's see. And avoid bruising. It's tough, but we try to stay as superficial as we can. Is there anything I'm missing? Does the audience have any questions?
Yes.
Yeah, we have to
Go ahead.
Questions. First, is she numb yet? Or is she going to be numb soon?
She's not numb. You will not need any numbing. We don't numb. There's no reason because it's quite comfortable the way we're using the treatment.
And then Sarah, are you nervous?
No.
Okay.
Tell the audience why are you not nervous?
I know I'm in good hands, so I'm not nervous at all.
Okay.
And then someone's son is 24 years old, but he has wrinkles on his forehead. Can he get Botox or Xeomin?
Yes, definitely. For guys that genetically it's not their fault, or they just have very deep creases, especially for male right here, and they look really refreshed after. Did you? How old?
24 years old.
Oh yeah, sure. If you're 18, you could get this. Okay, and let's see. Oh, other areas that we actually. Now I'm going to talk about areas where I'm going to do injection. Okay. So using toxins, we could do two things. Get rid of wrinkles. Number two is for lifting. Okay. And then we're going to be using, if you cut pan in, we're going to be using this BD tube, a small BD tube that allows you more control. Most of the time it hurts less. And, okay. So, okay. So we're going to be just doing a little bit. Look out for me. She has some fine wrinkles here. I want to give her a little bit. And I will not treat here because it'll give her a nice brow lift. And I'm going to look at her furrows. I want to treat here, deeply, mid-depth, superficial. Show me her nose. Wrinkles. I want to give her some treatment there. And I'm going to give her a drop right here to open up the canvas to kind of give her a whiten, like lift this up like that. And I'll put a drop right here, right there. And I'll do a superficial one there. And the chin one right there. Now, you guys want a penny because we're going to do the neck. Show me your lower teeth. I'm going to do one there, and do one on the jawline. Okay, so there's a marginal mandibular nerve that comes here. So you want to treat inferior to it, which is inferior jawline right there. And then I want to give her some Microbotax for the necklace line and just to boost the skin to prevent wrinkles.
Joseph, we have another question.
Yeah.
What does superficial mean, and what does injecting superficial mean?
And I will show you exactly. It's about, if you look at your pinky finger, this is almost 10 millimeter. It's about 1/10 or 2/10 of your the nail bed of your pinky, because that's about 10 millimeter almost. And I will show you exactly what that means when I inject. So show me your lower teeth. All right, so let's demonstrate what is superficial, what is deep. So keep this in mind. I'm gonna just talk about superficial and deep. Okay, ready? Okay. This is a superficial injection. So I'm gonna just give it. See that little. How do you feel?
I didn't even feel.
Oh, well, okay. My lucky day. But usually this shouldn't feel too much. Okay, so that's superficial. Look, compare and look at the needle. I'm just gonna go in like. See, very little. Now I'm gonna show you a deep injection. So superficial, deep, okay, and this is superficial. So here's a deep injection right here. See how the needle goes in all the way? Okay, again, deep. See how the needle is buried underneath? Now this is med depth. Right there. And now I'm gonna do superficial. So it's deep, med depth, superficial. Again, deep. See how the needle is buried all the way? Med depth. And superficial. If you have any questions, let me know. For those who actually commented and asked the question, the last person that asked the question or commented, you will. I'm gonna throw in that you will be the first one to get the 10 units. All right.
Ooh. And then they also ask, do you have to mold the filler with your fingers, like
The Botox?
Botox? Yeah. Or is it not Botox?
What's the question again? Are you talking about filler or Botox? This is Xeomin, more pure than Botox. So what's the question?
Do you have to mold it with your fingers?
When you inject this,
Mm-hmm.
most of the time you don't. Like, to prevent the droopy eyelids, you don't want to push this area because the medication might go here. So just try not to touch anything. With fillers, yes, you do, but with Xeomin, Botox, this for don't. The post care says you could push it up like this lightly. No molding. All right, that's a good question. You're the second that gets the 10 units. Please just reply yay, and go to our Instagram and message Jen. Say, hey, I want to get that in my account. All right, so this is a superficial injection here, and there are a lot of vessels. So see how little I just gave. Okay, and again, very little superficial. All right, so for here, I prefer deep because then you could really get the muscles. You could go deep. Some authors do advocate very superficial. Both all work. So for this time, we're just gonna do a little superficial, okay? But if you press it, it actually goes in too. All right. Now, let's see. So I avoided this area, which caused droopy cheek. Now I'm gonna do the upper lip. It's called a lip flip for wrinkles, and to give her that nice, showing her ergo trim, showing this length. This morning, my wife and she was looking at the mirror and said, "How come my lip looks like it's aging?" I said, and she can't tell what's going on. And I explained to her because our lip gets longer as we age. This actually gives you the appearance of a shortened upper lip. So that was a superficial injection. And I want to give her a very superficial injection here to avoid that inversion of the lip. Now I'm going to go to the DL to lift her mouth corner. And you could go deep here, but I can just do it superficially just to prevent DAO injection side effect like twisted lip. And here we go. So I'm gonna go deep right into it to lift the mouth corner. For the chin, when it's definitely go straight down deep. Stay as central as possible. Some people do superficially to get the dermal insertion of the muscles. So that's deep. Now the fun part, let's talk about the neck. Could you lean back for me, sir? Thank you. I appreciate you doing so good, so brave. How are we doing?
Yeah, the needle's so small I don't even feel it.
Oh, okay. So this is how we treat the neck to lift the jawline, to tighten it, to erase the wrinkles here. So show me your lower teeth. Absolutely, all this region has to be very, very superficial. See, I grab it, pull toward me. Make sure you identify the platysma, not the sternocleidomastoid. And you actually could give quite a lot here. Look at my plunger. You could give 5 to 10 units at this injection site. Again, pull it toward you, away from the swelling muscles, and give it superficially. So that was treating the bands, the platysmal band. Again, I'm just gonna finish this side real quick. See her bands here. I wanna give her 5 to 10 units. See, I go in deep like this, but you gotta make sure you pull back. And it's actually a dermal injection because the platysmal muscle is so thin. It's probably the thinnest sheet of muscle in our body, and it's just right underneath the skin. And there's very little fat in this region. Definitely there's more fat here, but less fat. Okay, so we just did a neck lift. One part of the Nefertiti neck lift is treating the jawline too. So to avoid the margiomandibular nerve here, you pull up, okay, identify the border, and you inject inferiorly. And this is from, again, this is superficial, like getting the platysmal muscle. Definitely deeper than the sub-Q because the muscle is underneath the sub-Q. So again, you want to pull and treat inferiorly. Superficial to mid depth. Okay. Okay. So I'm just gonna draw the finish this within 2 minutes by showing you that there's one thing that you could also do is avoid this region, and you could really rejuvenate the neck by putting Microbotax, or we call it Mesotox, under this region to help tighten the skin of the neck and help improve the wrinkles there. The fountain of youth using these micro droplets. Now I told you about sternocleidomastoid, but what am I treating over? Well, I'm actually not injecting into the muscle, I'm just treating the skin on top of it.
Sarah, the people say you're gorgeous.
Oh, she is very beautiful. Okay, so here's the Microbotax. I drew these large circles just for reference, but you could actually just give a lot of these small blebs here. Okay, like this. Anybody want to know how many units maximal is a safe dose? Anybody care to guess? Audience? Yeah, so if you're treating the platysma, for females, say dose is 30 to 40. But if you're platysmal bands, but if you're just treating for rejuvenation, I stay conservative. I stay with 20. Can you guys see? Can you guys pan in and really see this? Right. So you just kind of, and she's being very brave. Okay, I'm just gonna finish up with this one. So let's pan in really close on this side right here. Pan in all the way here. So what we're doing is called Microbotaster, rejuvenate the neck to tighten the skin. You can leave tons of these little blebs safely and effectively by treating in the right layer. So this is definitely a dermal placement. Right here, and we have one more. So she could get this every 3-4 months or twice a year, and you will see her that you will keep the neck nice and beautiful. Okay, so Vicky,
Yes. Alright, so wow, that was a lot of very good information. How are you doing, Sarah?
I'm feeling great.
You're doing great. Okay, so next we're going to have a raffle for the 10 units of Xeomin, which is worth $100, and we're going to have 10 winners. Right?
Yeah, so that's something we'll do. Please save the link. We're gonna have an official one tomorrow, but for today, we're gonna give whoever asked the last question gets 10, and whoever commented today, if you're the third to comment, you get 10. So I'm gonna choose 5 people, and please message us on Instagram. And the last one is just pick someone. So there should be 5 to get 10 more units. Hey, I appreciate you joining us. Tomorrow you'll be able to get our Super Black Friday, Cyber Monday specials when you join. Great.
Yeah,
Thanks,
make
guys.
sure you
Yeah,
come
make sure you
see us.
tune in tomorrow.
Mhm.